All right, let's get started. Good afternoon, everyone. It is 12 noon in the Eastern United States, but I know that we have some folks with us who are all over the globe and at various time zones. Wherever you are, thank you for spending a few minutes with us. On behalf of the Society for the Psychological Study of Social Issues, we welcome you. SPICY is an organization of over 2,000 psychologists and other social scientists involved in research, public policy, advocacy, and other efforts in the pursuit of social justice. Through its 85-year history, SPICY members have sought to apply scientific evidence and theory to pressing world problems, including prejudice and discrimination, poverty, environmental justice, social justice, gender equality, migration, and human rights. Headquartered in Washington, D.C., SPICY supports grants, fellowships, internships, as well as advocacy events in Washington and New York that facilitate social scientists in the communication of evidence-based policy. SPICY has been active at the United Nations since its early years. SPICY leaders and membership work closely with UNESCO during the 1950s and 60s, developing a research center focusing on prejudice reduction and intergroup conflict. SPICY has attained special consultative status with ECOSOC since the 1990s, as well as the United Nations Department of Global Communications. Our United Nations team produces statements, participates in the Psychology Coalition at the UN, as well as Psychology Day, and we host parallel events such as today's. Before we get started, SPICY would like to thank some of the co-sponsors of this event: the American Psychological Association, the European Health Psychology Society, the International Council of Psychologists, the International Union of Psychological Science, the Psychological Coalition of NGOs, ECOSOC accredited NGOs at the United Nations, the Society for Industrial and Organizational Psychology, and the World Council for Psychotherapy. Thanks also to Lauda Lopez Abar, who has truly been the heart and the hands of this very important event. Lauda is a graduate intern with the SPICY United Nations team, and we are incredibly proud of her today. We are also honored to have a former intern, Priya Dashani Santanapachai, join this event as moderator. I don't know exactly what time it is in Adelaide, Priya, but thank you for being with us today or tomorrow as it is. Priya will now provide us with some opening remarks.
Thank you, David, for that introduction. Well, it's in Adelaide, it's 2:35 a.m. Saturday, so joining a little bit ahead of y'all. For others, good afternoon, everyone. I am Priyadarshini Sandanapichai. My pronouns are she or her. I'm a PhD student in clinical psychology at Flinders University in Australia, and I'm also a proud SPICY United Nations team alumni. So I'm extremely honored to welcome you all for our panel event organized by the SPICY team for the CSW this year. So before we move on to the discussion, I'd like to give a brief overview on the theme of our panel, on why we chose this topic and why is this an important discussion that we need to focus on. I'm pretty sure that most of you all have heard or come across this word very often in media or even in political agenda. It's one of the biggest global challenges that we are facing right now, that is climate change. In the past few decades, undoubtedly, human activities have accelerated this process at an alarming rate, causing adverse effects on the environment, economy, and health. And today, this panel will be focusing on a critical matter that's most often not thought a lot about in this conversation, which is gender-based violence. As one of the 12 critical areas of the Beijing Declaration and Platform for Action, violence against women and girls impairs their enjoyment of their human rights and fundamental freedoms as well as the achievement of equality, empowerment, development, and peace. Experiences of gender-based violence can include sexual, physical, or psychological violence. Although all genders can be victims, studies show that women and girls are more likely than men to be victims. The WHO also has reported that approximately 42% of women who experience this suffer from minor and major injuries due to the abuse. Moreover, women facing gender-based violence report higher level of anxiety, depression, and post-traumatic stress, and they are heightened risk for suicide. Some of you may have hard time connecting these two issues, like wondering how exactly these are related. What's the relationship between climate change and gender-based violence? Let me give you some hints. I'm pretty sure that our panelists will elaborate on these in a few minutes. But a peer review article with 130 studies revealed that girls and women often experience high health risk from the impacts of climate change when compared to boys and men. In communities where there is water insecurity, 4 in 5 women are responsible for collecting water. Women and girls experiencing water insecurity are more likely to experience gender-based violence and other types of attacks by non-partners. This has been linked to the role of women as household managers and their partners considering it a failure when women are unable to provide the household with water. So despite the hard work, women are not involved in decision-making process or have property rights or access to environmental goods and services. And that's how the inequity adds to their vulnerability to climate change, causing gender-based violence and psychological distress and other health risks. Therefore, the goal of this parallel event is to address the issue of gender-based violence as exacerbated by climate-related events. Our panelists will share evidence on the causes, correlates, and consequences of climate change in the phenomenon of gender-based violence against women and girls and propose recommendations for effectively alleviating it. Before moving on, I'd also like to remind you that we'll also have our interactive discussion at the end. So if you have any questions during the speaker's talk that you want to raise, please feel free to send them in the chat box so we will be able to go through them at the end. So without further ado, I'm going to invite our first speaker, Dr. Laura Gauer Bermudez, who is a psychotherapist in private practice in New York, where she specializes in work with adolescents, young adults, and humanitarian aid workers. She holds a master's degree in social work from Washington University in St. Louis, a master's degree in international public policy from Johns Hopkins University, a PhD in social work from Columbia University, and a certificate in refugee protection and forced migration study from the University of Oxford. She's also a licensed master's social worker in New York State. Over to you, Laura.
Thank you so much, Priya. Okay, I'm going to share my screen here. Okay, can everyone see this all right? Perfect. So my name is Laura Gauer Bermudez. Thank you so much for the introduction, Priya. As Priya mentioned, I come to this conversation both with a background in human rights and humanitarian assistance, doing programs and research, but also in the clinical space as a clinical psychotherapist. So also bringing that lens to this conversation as well. And I'm going to be talking about a little bit of an overview from my perspective of the 3 main areas where climate change and gender-based violence connect. I'm going to talk about the connection between climate change and economic stress, and that further connection between economic stress and gender-based violence. I'm going to speak also about the connection between climate change and early marriage, a form of gender-based violence, and the connection between climate change and risky migration, which we know affects adolescent girls and young women at higher rates in terms of exposure to violence. The first is climate change and economic stress. We know that climate change has disrupted both agriculture and aquaculture livelihoods for many across the globe. Rising sea levels and extreme weather events have perpetuated a loss of livelihoods and diminished food security for many. Now, this loss of livelihoods can lead to a loss of power, a feeling of power, and a loss of a feeling of control, particularly for those who were primary income earners in the family. There was a study that was done by some colleagues of mine at Columbia University in Haiti that I worked with them on. It was a qualitative study looking at Haiti post-Hurricane Matthew. And the focus of the study was to understand the interpersonal dynamics within families and the propensity for IPV following an event of this nature, following a natural disaster. And one of the things that we found was there were high levels of this kind of feeling of inadequacy and frustration among male income earners. In these families, males were the ones who were those who were supposed to be providing income for the family. And so when they were unable to do it and they were asked if they would be getting a job or bringing money in by other members of the family, they would become very frustrated. They would feel insecure and they would feel angry. And for those who did not have models about how to express their anger or communicate their anger in a healthy way, many of them lashed out with violence, whether that was physical violence, psychological violence, or sexual violence against intimate partners and other members of their families. And again, as we know on the clinical side, that violence is a cycle. So when you see it in your own family, from your own parents, when it's been done to you, when you are under stress, that will be your first default to fall back on, because that is the model that you have had. So we'll talk in a minute about how we break that cycle. And not just in Haiti, but there are numerous articles that demonstrate that economic stress is associated with higher incidence of IPV, intimate partner violence, around the globe. The Lucero article is using the Fragile Families data set in the United States, a large data set, looking at and demonstrating again that economic stress is associated with higher incidence of IPV. The second area and connection that I want to make is the connection between climate change and early marriage. So for those, many of you I am sure are familiar with early marriage. This is the idea of primarily adolescent girls being married before the age of majority. Typically UNICEF would say before the age of 18. Now we know that early marriage is influenced by two things. It's influenced by cultural and social norms, but it's also influenced by economics, and largely is a financial proposition. So when we think about early marriage, when it comes to social and cultural norms, families often see it as a way to provide a perceived sense of safety or security for their daughter, to feel like their daughter is not in a place to potentially be seen as having sexual shame or having relationships outside of marriage. So if they're able to put them into a relationship with a male figure, then they feel like they are safe and secure in that realm. In the economic sphere, there is an incentive to marry a daughter young, particularly if you have a number of dependents in your household. And when you are able to place your daughter in another household, it is no longer a dependent that you need to care for. So there is a financial proposition to this. Now we know that climate events create economic shocks. And we know that climate events have been increasing. In fact, the WMO said that over the past 50 years, climate events have increased 5-fold. And because early marriage is a way of addressing economic shocks, we will see more of this unless things are done to decrease the prevalence of it. So there's a number of studies, particularly in Bangladesh, that look at how early marriage is used essentially as a coping strategy, a financial coping strategy to deal with the economic shocks of severe weather events. And I have them cited here for anyone that would like to see them moving forward. And then the third and final connection that I want to make is a connection between climate change and risky migration. So we know that migration is a common way to deal with issues such as rain variability, food insecurity, that migration is an adaptive mechanism to when you have scarcity in your source location. If you do not have enough food, if you do not have enough access to jobs, you will move. It is an adaptive way to access what you need. We also know that adolescent girls and young women on the move are at a higher risk of physical and sexual violence. This is both with forced migration, refugees, IDPs, as well as migration from rural areas to urban areas in one's own country. We have recent, yet to be published, but will be published in about a month, research from an organization that I work with right now that's looking at overseas foreign workers from the Philippines to a variety of destinations around the world. And what we found was that the group that had the highest reports of violence against them, physical violence, sexual violence, psychological violence, were adolescent girls from the southern part of the Philippines going to the GCC. So we know that adolescent girls as a group typically are going to be exposed to more violence, more exploitation at their destination. Now, at the same time, migration serves as an opportunity structure for adolescent girls and young women that they might not otherwise have had. And it can be an alternative to early marriage for some as well. So it's so important to understand both the risk factors of migration, but also the opportunities that it poses in order to make migration a safe and secure opportunity for adolescent girls and young women. So to close out, a couple of recommendations that align with each of the three areas that I talked about. The first is about breaking the cycle of gender-based violence. Again, as I mentioned before, we know that interpersonal violence is a learned reaction to stress within families and within communities. Norms around violence must be disrupted, they must be broken. And I suggest looking at the work of a group called Promundo, who does wonderful work around the world, working with men and boys to challenge some of the notions they have around masculinity, to challenge the norms that they have grown up with about how they treat women in times of stress. The second is preventative work in communities can reduce the commonality of early marriage, again, by addressing social norms. So if early marriage is based on two things, social norms and an economic stress, we can address the social norms through groups like Tostan. These are nonprofit organizations that, again, are working on social change with the local leaders to have a critical analytical look and say, is this norm serving us well, or is it time to change? And what does that look like? Groups like Tostan have been doing this around the world in a really wonderful and effective way. When it comes to economics, we need to ask the question, what additional economic and social policies can governments put in place to deter early marriage? Policy analysis by groups like ICRW, the International Center for Research on Women, and UNICEF and Echente have done some wonderful work around looking at cash transfers and other incentives to keep girls in school and out of early marriage, to essentially solve the economic issue that is driving early marriages. And then third is migration. We know that migration will only become more frequent. How do we make migration safer for adolescent girls and young women? If it is an opportunity for them, how do we make it safer and more secure? How can we make labor migration safer with adding in additional monitoring mechanisms, grievance mechanisms for reporting when there are issues, making it easier to repatriate from a job that's exploitative? How do we make it more formalized so that it can be more protected? Look at the work of the International Organization for Migration and others for what they're trying to do to make these corridors safer, more protected for adolescent girls and young women around the world. That is all for me, but I have left my contact information. If anyone is interested to pursue any of these topics further, you're welcome to reach out to me in the future. Thank you.
Thank you, Dr. Bermudez. You brought in a unique perspective of how economy could be a mediator in the number of issues from early marriages to migration, because as someone who's not an expert in this field, I'm just thinking, how can these issues be related to climate change, whether it's migration or economic shock? I'm pretty sure our audience will be just thinking about it. Oh, there is a relationship between these climate-related events kind of triggering these issues or exacerbating, like migrating or early marriages. So your presentation was really an eye-opener, could have been for a lot of people, so thank you for that. So our next speaker is Emmy Gaman, who has over a decade of experience in leading impact-driven teams and programs. She is passionate about ensuring sustainability and working directly with communities to develop solutions to fight poverty and bring justice for women, youth, and children in Nigeria. In addition to her role leading NURU Nigeria since 2018, Emmy serves as a One Champion in Nigeria Chief of Party for the Building Sustainable Livelihoods program, sponsored by USAID, and has received various awards, including Adamawa State Humanitarian Ambassador of the Year, recognition by the British Council through the Northeast Hub, and has been named a perennial fellow. Over to you, Emmy. I am going to share your screen right now.
Hello, good morning, good afternoon, depending on where you're coming from. Priya, thank you for the warm introduction. Please permit me to off my video because of my internet connection. Very poor in the Northeast, and I'm in a field area, I'm in a remote area. Like Priya had mentioned, I'm very passionate about working in a remote area. All right, we are talking about gender-based violence and climate change. It is no longer news that climate change is a gender-neutral crisis that we have to face as a global community. It is faceless, it is voiceless, but we feel the impact directly as a community. Next slide, please, Priya. Click on it. It is easy to forget amidst different levels of crisis, including a global pandemic that all of us have gone through, and I'm glad that we have been able to survive. Possible Second World War, like we have already started seeing between Ukraine and Russia, and it's affecting the global economy, including Nigeria. You know, definitely for us in Nigeria, about 50% of our wheat is imported from Ukraine. So this war is affecting everyone on the globe. And other humanitarian conflicts that are happening all over the planet. We cannot talk about South Sudan, Venezuela, and other countries, including Northeast Nigeria, that are suffering from all of these crises. But in every crisis, just like the wars that I've already mentioned, 80% of the people who bear the burden of this crisis or the aftermath of the crisis are women and girls. Next slide, please. For the purpose of this conversation, I would like to bring it to the context of Northeast Nigeria. In Nigeria, just like many countries in the world, the impact of climate change is deeply felt in different forms. The Northeast has experienced flooding, drought, heightened temperature across its territory. In the Northeast right now, we have had the effect of climate change being exacerbated by insurgent activity. Over 2.1 million people are in displacement, just as the DTM metrics has stated. Apart from the people being in displacement, I want to also mention across the 6 states that are painted in red, 79% of the people who are in displacement are actually women. And about 90% of the populace of the Northeast depend on agricultural production as their livelihood. With climate change, we have witnessed reduction on the production and productivity of agricultural activity, of which women are 65% of the 90% I earlier mentioned in the Northeast. Next slide, please. Gender-based violence experienced due to climate change. Of course, as we already know, research has proven over the years that women have been denied access to land, whether it's inheritance or procurement of land, or even for myself, who are termed as career women in my community, who cannot procure land without bringing our spouse into the conversation. And definitely the conversation has to happen with a male before that procurement happens. This denial of access to land has increased over time because land has become a very valuable resource in the Northeast. In Nigeria, with astrometric progression of our population growth, of course, land has become very scarce for us as a country. And with insurgents activity in the Northeast, access to land is limited because you cannot go to a place where your life is in danger. We have also witnessed increase in early child marriages. Now, Early child marriages in Nigeria, I think as the first speaker has mentioned, is increasing across the globe, but in the Northeast, it has a specific context. The context is now children are used as a means of trade by barter. So parents can give out their child for them to acquire a resource like land in exchange. We have also witnessed heightened ethno-religious crisis, a crisis between farmers and herders. In a research by Search for Common Ground, it shows that 73% of the people who were killed in this crisis from 2018 till date are women. We've also witnessed increase in maternal and child mortality. And this increase is happening because of the nutrition gap that has been experienced because of conflict. Next slide, please. The effect of climate change is exacerbated by poverty. Of course, we know that there is uneven distribution of resources across the globe. And poverty comes with educational gap. It also comes with lack of awareness. So a lot of times we find out that in rural area, without knowing, just like we know, women are the managers of the home. They go to get fuel from the forest without knowing the effect or the implication of doing that. Cutting down trees like acacia that would have supported with nitrogenous contents in the soil. We've also seen that climate change has increased inequality across our community, leading to food insecurity. It has shown that there is limited knowledge on climate change, limited awareness.
I'm sorry, Amy, I think you're cutting off right now. Can someone hear her?
Tune with research population growth has affected. Hello, please, can you hear me?
Yes, I think the signal is a little bit weak, but I think we can hear you right now. Yes, you can continue.
All right, thank you. Next slide, please. Next slide, please, Priya. Okay, no, the previous slide. I want to talk about some of the solutions we can be able to have. And this solution needs to come with a fierce urgency of now, because our planet is gradually dying. The world has to go through a transformation to be able to fight this climate crisis. Next slide, please. In my work in NURU, Nigeria, and our contribution to this fight, we have focused on regenerative agribusiness model. And in this, what we do is to actually provide farmers with cash crops, leguminous crops that support in nitrogen fixation in the soil, basically granite and soybean value chain. We also encourage the use of biofertilizer. We do intense capacity development on social and behavioral change so that we can be able to cover harmful norms that are silent in our community. Some of those are female genital mutilation, early child marriage, as mentioned, poor infant breastfeeding, and then nutrition at household level. In our nutrition program, we promote plants like fluted pumpkin, spinach, cabbage, okra, tomato, cucumber, and pepper for these women. I want to mention that over 70% of the participants of our program are women, and 50% of them are taking up leadership role in the farmers' cooperative and farmer organization. After a conflict, as usual, some of the impact is financial shocks, economic shocks, and stressors. So our financial inclusion program is focused on access, affordability to financial services. And it is done on a digital platform where women groups and men groups are involved in savings and loan activity. Our program is very inclusive, community-led, community-driven, and community-sustained. We start our program with a co-creation with the community. Next slide, please. I want to also say, as a solution on a way forward on this fight on climate change, we have to utilize the power of collective action. We have to be very deliberate about collaboration as partners. In most cases, we notice that partners think that collaboration is not effective. But over time, I have seen in my work that collaboration is the most effective way for us to win this war. The time for siloed approach in program implementation is over. We need to bring together health intervention, education intervention, agric intervention on the same table for us to be able to move forward. Next slide, please. A multi-sectoral approach to development program is also going to be very effective in helping us fight this war. Because as we talk about climate change, now we are talking about gender-based violence. There are other underlying factors that also are caused by climate change. Of course, food insecurity is one of them. It will be very healthy for us while we intervene in agricultural programming to also consider areas like social cohesion, peace building activities in the community. Like I said earlier, the time for siloed approach to programming is over. We need to focus ourselves in integrated programming. Next slide, please. It is also time for a clarion call to increase investment in regenerative agriculture. As it is, agriculture is the way forward for us as a planet. That's the only way we can be able to curb food insecurity and be able to fight the effects of climate change. Next slide, please. Finally, and most importantly, I would like to use my voice and the voices of other women across the globe to say, women, we need more women in policy design, policy implementation, leadership, and in all rooms where decisions are being taken. After all, we form 50% of the planet. In Nigeria, we are 49.4% of the country's population. However, only 13% of women are seen leading in the country. In my home state, only one woman is in the House of Assembly, where discussions about the state is happening and decisions are being taken. So we need more women in decision making. If we can trust women with nurturing of leaders, with nurturing of our homes, with the health of our homes, then we can trust women with the decisions and policies that will make our planet grow. Thank you so much.
Thank you, Amy. That was a really wonderful presentation, and it's also reiterating the importance of women in decision and policymaking power, because the facts shows that women involved in 50 to 70% of food production, but they still lack the authority over their land and resources. So we really appreciate your work with NURU in developing, from regenerative agriculture to financial inclusion, which will definitely empower more women in such situations. So thank you for that. And next, I'd like to invite now Agnes Rieger, who's currently in the Clinical Community Psychology PhD program at the University of Illinois. She works under the direction of Dr. Nicole Allen on the Action Research and Collaboration team. She does research involving community and societal intervention to prevent and respond to domestic and sexual violence, including public health approaches, social norms and system change, and in providers. Currently, she is a research assistant for a statewide evaluation project that partners with the Illinois Coalition Against Sexual Assault and the Illinois Department of Public Health to investigate sexual violence prevention efforts across Illinois. Aggie, the floor is yours.
I'll start by unmuting myself, right? Thank you. Well, thank you for this panel and for the wonderful organizers who did so much to make this possible. I know I am learning so much already. As Priya said, I am a PhD student, so that means my expertise is slowly but steadily growing. So I'm here to share some food for thought and themes from our broader research field. And my hope is that we leave our time together with a curiosity and excitement for thinking about ecological interventions for gender-based violence. And I mean social ecology, although we've already heard such rich details about how to consider that particular intersection between changes in ecology related to our climate crisis and GBV in particular. So Dr. Nicole Allen, my advisor, trains us to be action researchers. So that means we have a great motivation and investment in translating existing research into these tangible steps forward, as well as in partnering with communities and organizations. I also want to say I appreciate that this action research frame is something that SPSSI has pushed forward. So I'm going to share about a rapid review and commentary piece that I led with a wonderful team at the University of Illinois. I'll also tell you a bit about one of our recent studies that examines how some GBV practitioners may be moving towards some of the tenets that we'll discuss. So we'll have a bit of theory as well as applied practice research today. So these are the main takeaways I hope you have for our time together. The first is thinking about gender-based violence as a complex social problem. Thinking about using the social ecological model and an intersectionality lens as a starting point for understanding complex social problems, including gender-based violence. An idea that interventions across SEM layers, which we'll talk about, might be most theoretically sound and effective. And finally, that moving to the outer layers in prevention and response is both possible and challenging. So what do I mean when I say that GBV is a complex social problem? Well, when you think about gender-based violence, what do you think causes this kind of abuse? What might be done to prevent it or to lessen its impact? So one could think about GBV as an individual level problem. There's something about you, there's something about me that makes victimization more likely. For example, one could craft a narrative about GBV happening to some people in part because of a proclivity or something learned to be repeatedly targeted. A corresponding intervention might be coping skills in acute crisis or efforts to try to get a survivor to make different decisions, thinking that might end violence in their life. But what many GBV activists and community psychologists, and what we've already heard on this panel today, is thinking about violence that instead festers and flourishes outside of an individual. Something that is rooted in inequities, in social power and privilege. This could help explain some disproportionate rates of how GBV is concentrated and more often targeted at people who have been marginalized. Helps us understand how systems and social responses can complicate prevention and healing. So abstractly, this conceptualization means thinking about violence as that complex social problem, something that is beyond any given person. More practically, this invokes interventions such as longer-term advocacy that seeks to change the context of people's lives. Again, what we've already heard about on this panel, targeting oppressions, inequities, lack of access to resources and real opportunities, and doing that as a means of reducing and responding to GBV. For example, Sullivan and colleagues at Michigan State have pushed for long-term housing options above and beyond the acute crisis management. Their work is called the Housing First Project. Also, domestic violence coalitions, such as the Oregon Coalition Against Domestic and Sexual Violence, and GBV activist groups in the US that are often led by people of color, including Insight, have pushed for these kinds of more structural root cause interventions for many years. So thinking about COVID invokes all of this existing work on social structural understandings of GBV, which is what our team wrote about in a recent paper. We were really motivated by the changes that we saw in many of our lives and in systems that often get presented as, well, these systems just change really slowly. They move at the pace of dinosaurs. We saw something a little different happening in some spaces in response to COVID. We were also really inspired by connections to people who did GBV prevention and response every day, and the real difficulty we've seen people have in getting tangible support in making COVID-related adjustments and meeting COVID-related demands for this work. Today's panel is, of course, all about GBV and the climate crisis. So how we might frame and begin to understand GBV complications in the wake of COVID-19 might also be helpful for considering possible complications connected to climate change. The possible extension here is that both COVID-19 and our climate crisis result in rapid and sometimes devastating social changes and systems changes. So I'll share a few highlights that came from our rapid review and commentary. And a review like this is our kind of formal academic way of thinking about how COVID-19 responses, particularly the necessary social distancing and closing practices, could carry unintended consequences for GBV survivors, providers, and significant others. So just as we began our time together thinking about GBV as a complex social problem, this structure is a good example of that consideration tangibly being put into place. It's questioning how systems respond, changes in social behavior, and seeing that as coalescing to have a tangible influence on violence and on violence survivors. Right? It's not something about COVID as a virus that changes the reality of GBV for many of us. It's what we saw systems do because of and in response to COVID that has a real impact. In our review, we use a simplified version of the social ecological model. This is an oldie but a goodie tool for thinking about different vantage points and levels of intervention for any social concern. This simplified version of the model is from the Centers for Disease Control and Prevention, in which the CDC has adapted ecological theory in its prevention funding, which is also just a very exciting advance. So in practice in the United States, many GBV prevention and response interventions are at the individual level. These are things that could help individual people at a time. So that includes important acute medical care, therapeutic interventions. Relationship levels include folks who are already close to each other. So this could include helping significant others support a survivor or pass along important messaging and beliefs. Community level interventions includes norms, local facility, businesses, community practices, and policies. And then the societal level speaks to broader laws, norms, what time we're living in. So in our review and commentary, and here with you today, we advocate for what many scholars, including Kimberly Crenshaw and activist groups such as Insight Network, have again advocated for a really long time. That in considering prevention and response to GBV, we must consider how multiple interlocking oppressions influence each other and have different effects on people and communities. For example, social distancing practices that we've seen in the United States, again, a necessary public health response, can interact with disproportionate economic hardships on people with less economic resources and social capital due to structural oppressions. And similarly, when you're designing an intervention, a one-size-fits-all intervention often in practice just means an intervention that was designed for people with more power and privilege in mind. People face different barriers as a result of oppressions, and multiple oppressions being targeted at a person or peoples can make accessing resources especially difficult. So here are some examples of various factors that we considered at each level. And you can start to see how these levels influence each other, how they bleed together. And because we wrote this review with COVID system changes and COVID system impacts in the US in particular in mind, you might start to see your own connections with how communities and systems might change and be impacted in the wake of the climate crisis. So one takeaway here is that individual level work is important and it should not go away. And if we only ever intervene with individual survivors in acute crisis at a time, then perhaps we will just always have more and more individual survivors to intervene with. One thing we end our paper on is this idea of combining gender-based violence in particular efforts with efforts that are more generally ameliorating structural inequalities and prioritize the creation of resources and opportunities, especially with people of marginalized identities in mind first. So this is a crash course in how community psychology as a field often thinks about GBV. But even if you logically agree with something, that doesn't mean that implementing it is particularly easy. So I'll highlight a few of our recent findings from a partnership with people who do sexual violence prevention in nonprofit organizations. So we really wanted to understand, how do these preventionists conceptualize GBV, which is what we've been talking about today, as well as the practical barriers and supports to doing that actual prevention work. One of the most interesting pieces in this research is some really rich contradictions we found in this qualitative study. So you might connect to this. As a psychologist in training, I certainly connect with this. The idea that a person might really believe in the need for outer layer change for GBV and may deeply buy into that need, but then find themselves in practice implementing individual level interventions for GBV to the exclusion of outer layer interventions. For example, that means saying that you believe evidence that suggests that oppressions fuel GBV, but realizing that your interventions largely focus on helping individual survivors at a time. So informed by existing innovation and implementation literatures, our study identified these 7 ecological factors that were preventing preventionists from implementing outer layer GBV prevention work, even when they really wanted to implement that kind of prevention work. So when identifying these factors, we're again asking what's happening in the context of preventionist. What is that context that is shaping GBV prevention implementation? What is sometimes pushing us towards the inner layers, even when we want to go to those outer layer community and societal level interventions? For the sake of time, I'll just highlight 2 examples. First is highlighting the dramatic change that shifting to outer layer work entails for some preventionists. People were highlighting just logistical issues in doing this policy practice change work. That includes things as, I'll use air quotes, simple as how do I count my time at work? Like how do my hours get rewarded? Really suggesting, like other implementation research has done, that if we want to move towards structural changes in GBV prevention more often, then we might really need to have structural ways that jobs reward that work. We also found repeated calls and the strong need for even stronger leadership in pushing GBV prevention work to the outer layers. Perhaps even more training, support, and teamwork might make this kind of prevention work more possible. So ultimately, in this lightning fast blip of our findings, I leave you with this idea. Believing in the need for outer layer change for gender-based violence is not enough. Training, messaging, leadership, partnerships to make this really exciting outer layer GBV prevention work might be especially needed. Listening to this panel already, especially Amy's call for that collective action across sectors that we urgently need now, that was so inspiring and so related to this work too, because it's really outer layer work that might be what's theoretically called for in responding to this intersection of GBV and our climate crisis. And we might need that systems change eye for understanding why moving from theory to practice can be really difficult. That's all from me. I'm really looking forward to the discussion.
Thank you, Aggie. That was an insightful presentation. I think now we're at a point that we have to restructure the way we look into research and add another layer of in the post-pandemic era. Now we have to include the COVID-19 and how the consequences will change all of these important matters. And also your paper kind of resonated and replicated. I think my SPC team would definitely agree with our white paper that we submitted last year, that we also talked about the parallels between COVID-19 and climate change and using a social ecological framework. So some of the factors that you were explaining, whether it's regarding individual level or how it's important to also incorporate the policy level or the national level, is important in addressing these issues. And how you're saying that how COVID-19 and climate change, there is like a direct relationship, and this could be the same with GBV and climate change as well. And climate change is more likely to create more pandemics, and that's more likely to trigger more like gender-based violence in most part of the world. So it's very interesting, and maybe in the chat box, I could put the article in the chat box so that you could see the similarities of what you were talking about and what the paper was all last year, but thank you for that. So moving on to last but not least, we have Dr. Nahid Rezwana, who is an associate professor in the Department of Geography and Environment of University of Dhaka and has been working in this department since 2005. Nahid Rezwana holds a PhD in geography from the Durham University, UK, and a first master's degree in geography and environment from the Dhaka University, and a second master's degree in hazard and disaster management from the Kingston University, London. Her fields of interest are hazards and disaster management, gender health and climate change. Her scholarship explores how and why disasters have uneven impacts on women and how these conditions could be improved with gender-sensitive disaster management. Floor is yours.
Thank you very much, Priya. It is my great pleasure to present some of my research findings. Let me share the screen. Can you see my screen?
Yes.
Is it okay?
Good.
Okay, okay. Thank you. Please let me know if it is not changing. Okay.
Maybe, I'm sorry, maybe you could enlarge it or put it screen share so that the slide will be visible much more, if you could.
Can you see now? Can you see the
we
screen now?
We could see the slides, that's fine, yes.
Okay, but it's not enlarged, is it?
Yes, that will be fine. You could see the slides on the side, but that's okay, yeah.
Okay, no, I can enlarge it and come back again. Is it okay?
Yes, no worries. You could.
Okay, okay. Take us. Okay. Thank you very much. I'm Nahid Rezwana. I'm working as associate professor in the Department of Geography and Environment, University of Dhaka. Today I'm going to talk about the relationship between gender-based violence, disaster, and climate change, taking examples from Bangladesh. Bangladesh is a disaster-prone country, and it is its geographical location, large population, economic conditions have created a vulnerable condition for this country to natural disasters and climate change. May I know, is my slide changing?
No, we seeing your first slide.
Okay, okay. I'm just.
Now we can, yes.
Can you see now? Disasters
Yes.
in Bangladesh? Okay,
Yes,
I'm sorry. Okay,
That's
so the major disasters in Bangladesh are cyclone, flood, river, coastal bank, coastal erosions, drought, waterlogging, salinity, and we have climate change threat too. Actually, Bangladesh is in the 7th position as a vulnerable country in the world, and this country has faced 185 extreme weather events between 2000 to 2019. Child marriage is another problem in Bangladesh. And before that, I would like to say that gender-based violence, social concern, major social concern in Bangladesh, even during the usual conditions. Almost 2/3 of ever married women experienced one or more forms of violence by their husband at least once of their lifetime. And according to the statistics, there were 975 rape incidents reported during January to September in 2020. And there were 43 deaths caused by rape in Bangladesh in the same period. So Bangladesh also have child marriage problem. Like Bangladesh is among the top 10 countries, actually in second position in the world for child marriage. And Bangladesh has the second largest number of child brides in the world. So if we think that, is there any relationship between gender-based violence and disaster? So today, I just want to focus on this question and try to get the relationship. For getting this answer, I want to take supports from my 5 researches, which were located in 3 disaster-prone regions of Bangladesh, in flood, cyclone, and riverbank erosion-prone areas. And all these researches were conducted between 2012 to 2020. And these researches has applied both qualitative and quantitative methods, sometimes mixed methods. Analyzing all these results of this research, it has been found that gender-based violence increases during and post-disaster periods. And gender-based violence includes child marriage, wife battering, rape and sexual abuse, trafficking, eve-teasing, dowry, and mental tortures. If we look at the results of flood research, we have found that 69% of the respondents said that gender-based violence is present in normal time. But according to 78% of respondents says that gender-based violence increases during and post-disaster periods. And the research on the riverbank erosion victims have also found that, according to all respondents, the gender-based violence increases among the riverbank erosion victims. And what are the violences? The violences are child marriage, child early marriage, dowry violence, domestic violence, migration, and trafficking. Now, if we focus on the result of cyclone-prone areas, and we can see these researches were actually based on qualitative and quantitative methods, and it helped to understand the context and reasons and impacts of gender-based violence on victims. So we can start from here that during the cyclone, women face sexual abuse on the way to cyclone shelters, at the shelter, and even during post-disaster periods at their damaged houses. And if we see the quotation, we can see that people, some people in disguise of volunteers, they abuse women when they find them alone on the way to shelters or even at their houses. And but when women reach the cyclone shelter, their problems that do not get reduced. Actually, we can see from the second quotation that in a crowded shelter, they reported there were different harassments and abuses, and we can see from this quotation that how a female has been harassed in her last experience. And also women also face and get harassed while they are receiving relief and attending disaster recovery program. Actually, during the post-disaster period, child marriage increases in number. Intense poverty and lack of security after cyclone disasters increases this number. And we can see from this quotation that parents was explaining that why she has married off her young daughter after the cyclone, because she felt insecurity. And also she said that the groom's family don't want any, did not want any dowry money, or they don't want any marriage expenditures. So she had to say yes. Actually, this is a common picture we can see after cyclones, and many marriages take place due to the intense poverty. Another violence increases after cyclone, and that is domestic violence, especially wife beating. And it is made worse by disaster-induced poverty, dowry violence, and chaos in the family. Again, there are some social crises have been reported by the victims. If we see that men reported psychological impact of disasters, and there were increasing number of addiction to drugs and violent behaviors among them. But while women face differently, families may become forceful, and women were beaten up if they did not want to collect relief in house. And even sometime after collecting the relief, their relief have been snatched or taken by their husbands and their families, and sometimes by their neighbors. And another thing happens that male family members often leave the area to get jobs in the big cities. But after some time, after a few months, they stop sending money to their families, and women are abandoned with their children in disaster-affected areas with immense poverty and insecurity. So what are the impacts of gender-based violence? If we start from the physical injuries, actually all violence ended with physical injuries. And we can see from this quotation, it's a very sensitive quotation, but we can see that impacts of physical violence, like the victim was saying that she has been beaten so many times after she got married, and not only her husband, the whole family participate in this torture. And she was not taken to treatment, and she faced pain. And actually, she was saying that she does not want to leave. She wanted to die, but I cannot go back to my parents. That means she cannot change her condition. So there were also psychological impacts in violence. And we can see that from the research, it has been reported that there were trauma, deep sadness, fear, helplessness, and losing self-confidence among the victims. And we can see from the quotation that one of the victims was saying that I'm afraid of cyclone shelter. I do not want to go there. That means that she is going to stay in her vulnerable house, because last time when she went there, and actually there were lots of unwanted touch and different types of violence has been committed against women. So now if I see the child marriage and its impact on the children, I would say that child marriage has both physical and psychological impacts. And the main thing is that the victim cannot finish her education. So if we look at these quotations, it says that a grieving mother was explaining that she had to marry off her daughter at 13 or 14 years, But the thing is that at the end, she got her daughter dead. That means that one day she committed suicide, but mother was not sure that if she has committed suicide or has been murdered by the in-laws family. So this is the end of child marriage. Not only this, the second quotation says that the victim cannot change her condition because she did not finish her education and she cannot get a proper job, and most of the time she is not allowed to get any job, or and we can see that she is in a abusive relationships and she has to be here. So question arises that what women actually do when they are in abusive relationship. The research has found that women tolerate, most of the women tolerate everything. But why? This is the question, that why? Actually, they do not have any place to go because their parents do not want them back. They don't want to take their daughters to return to them and take shelters because they are poor and there is some social humiliation. And actually, women also feel that there are insecurity being alone, and money and supports to file a case against violence. And actually, if they complain to local authority, this quotation shows that they got gendered advice that women should be more tolerated, they should be more patient. So this is the thing we should also focus, that they cannot, if they want to, but they cannot complain even. Of course, there are some positive steps. Some women could have taken divorce, and some involved in informal sectors after disasters to earn money, so that in teens, the disaster-induced poverty can be a little bit less for them, and sometimes they migrate. So all these research findings have found that gender-based violence increases during and post-disaster periods. So as it has been predicted that a number of disasters will increase, we can say that the number of disaster victims as well as gender-based violence victims will increase due to climate change. So what we can do, how to improve? I have 3 points here, that if we can prevent child marriage, it will be very helpful, and assuring financial support for women and gender-based violence victims, healthcare access for gender-based violence victims, and especially legal support for them would be helpful. Arranging awareness programs at national and local level, and of course, I would say that preparing and implementing gender-sensitive disaster management plan will be helpful to improve the condition. So that's it. Thank you.
Thank you, Dr. Rezwana. That was quite hard to digesting, like all the facts that you were putting on the presentation. It was quite shocking to see how child marriage is directly impacted by, after a disaster, a post-disaster in certain families. And your research is directly pointing to the answer that everyone had, how gender-based violence is related to climate change. So thank you for shedding some lights on that. And I'm just trying to digest all of this information. Now we are going to open up to the Q&A session. So just for a friendly reminder for the audience, if you have any questions, please put it in the chat box and we'll be able to answer. And we've got some questions in hand as well. So just without delaying, I'm going to ask the first question we had to all the panelists, if anyone would like to just go for it. Could there be a correlation between the intergenerational transmission of trauma and climate change? So that was a question from the audience. Please go ahead if you would like to answer that question. Would anyone like to go for it?
I can speak just briefly. I'm not sure about the intergenerational transmission of trauma and climate change itself, but the intergenerational transmission of trauma and the reaction to the effects of climate change may be a little bit easier to make that relationship, and very sort of similar to a few points that I made in the presentation about when violence becomes modeled as the reaction to stressors in a family, and that trauma is kind of passed down generationally, that the reaction to economic stressors from climate change would then be similar unless that cycle is broken. But I'm very interested to hear if others have potential connections that I have not made.
Well, definitely we can go ahead with the next question. Maybe if you have any points that maybe you can add on to that. I have actually a question to specifically to Dr. Rezwana and Dr. Laura, who mentioned about the cultural value and child marriage aspects. So I'm happy if anyone else also can add on to that, specifically focusing on the social context of your research, how cultural values and beliefs adds more weight to this matter, specifically when we are talking about dowry and child marriage. If you could elaborate on that.
So may I? Yeah, okay. Okay, so actually, if I repeat the question, that it is on the cultural value and how it works on taking the decision for child marriage. Actually, this is a tradition that people in many areas, as I have mentioned the statistics, as Bangladesh is now in second position for child marriage. It's people try to marry off their daughters early because of the younger the bride, the lower the dowry money. Actually, this is a tradition, and so this is one thing. But the problem is that after the disaster, and they do it with taking some time for usual normal time. What they do, they take it is a tradition and they have to. But after disaster, what happens? They don't take any chance to miss any opportunity. It means that whoever wants to marry their daughter, like the aged person or who has 2 wives already, they don't think about it. This is the main thing. And my concern is that it feels like that whenever there is a problem, get rid of the girls. And this is the main thing I want to all the time I want to present. I want to say that this is very alarming, that they feel like that whenever there is an economic problem, let us reduce the number of the daughters, like this. So that's why actually whenever there is any proposal or anything, and especially in damaged house, there are some there, you know, that the culture is like that. Women, they easily get humiliated. They are dishonored, lots of things, gossips. So they are afraid of those things, to losing their honor of their daughters. So that's why this is another thing, that they become insecure, feel insecure in a damaged house, that might be they can be kidnapped or anyone else. So there might be any incidents, and rape cases are there actually, if they are not attended by any guardians. So these are the things, actually causes. But my question is that this is actually why they think that they should do that. This is the main thing, because this is a tradition and it increases in number after disaster. And the main factor is gender. Actually, the main factor is gender here. Thank you.
I think Dr. Rezwana answered that question beautifully. The only thing I would add on to that she stated at the end is the main factor is gender. So one of the questions to ask is, why is it not the boys being married off? It is the girls, and to think critically about what does that mean for how we view our girls and what we imagine for their future and how we kind of feel about their value, and to think very critically about that whenever we're addressing a situation of marriage and adolescent girls and their value.
May I add one line here? Dr. Laura, I can say that they don't marry off their boys because they try to engage the boys to earn actually at the early age. It doesn't. It means that whenever there is disaster-induced poverty, they try to put the boys in a risky jobs, and whenever they can, they want them to earn money, and they marry off the daughters so that they can have. You know that this is a common strategy. They think that they should follow, but this is the boys also do not in those families in many times that the boys cannot finish the education also. So this is happening actually. Thank you.
So I want to quickly add on that, like some of the cultural norms that are in Nigeria that exist and then lead to child marriage, and how some of them interrelate with conflict. In some states in Nigeria, basically by law, and then of course, for us to have signed different treaty and other things, you're supposed to get married at the age of 18. But there are some states that in their own law, you can get married at the age of 11. So a girl child can be married out at the age of 11. I've also been in communities whereby if a girl child is being married out and she's not a virgin, only half of her bride price will be paid. So sometimes even the mothers are scared that this girl should not grow to a certain age and then lose her virginity before marriage, which is a shame to the family. Of course, with Boko Haram crisis, there were a lot of cases of rape and a lot of violence. And if a girl is raped in most of the communities where, even in the community where I come from, you are undervalued as a woman. So there was a rush for parents to let go of their girls so that the insurgents do not rape or take away their girls. You know, like I said in my presentation, in some cases, parents will give out their girl child in exchange for lands. So the land becomes the dowry, you know, because of scarcity of resources. So I wanted to add from the cultural perspective of where I come from. Thank you.
Thank you for that. The next question is actually open to all panelists, since most of you all touch upon the policy making. So what are some of the challenges in translating your research findings into policies? You know, talking about it on a policy level, how hard it is to kind of like implementing your findings going into an organizational level. If anybody would be able to answer that.
Let me come in here again. Currently, I'm working with the National Peace Committee in Nigeria on a work on designing a national framework that talks about gender-based violence in relation to religion and how religion actually increases the rate of this violence. So one of the things that I've noticed in my work is whenever you enter into the room, the first thing that
I'm sorry,
is that you're a woman. Okay, so I think I was saying that whenever, can you hear me now?
Yes, we can hear now, yeah.
So whenever you go into a room for advocacy, the room is actually filled in with men. So whenever you're communicating, you know, they cannot relate with the context of what you are saying. And then for them, it's a loss of economical power. It is a loss of the control that they have in their houses. So immediately there is a policy change, it means there is a loss of control. And I'm sure a lot of us have seen in the news that a lot of Nigerian politicians, some even, I think recently, a state governor of 65 years got married to a 13-year-old girl. So how do you even start this conversation in the House of Assembly or anything? So there is always that challenge. The other thing is that you go to a House of Assembly or a Senate sitting of about 51 people, and then you find out that there are only 8 or 9 women in the room. So it's like, shut up, just have your place. You don't have anything to say. So it's really difficult to advocate. It is really difficult to talk about these issues or even make policy propositions when the people you're talking to are somewhat the perpetrators. Thank you.
This question also makes me think of the role of research societies, research organizations, like collective statements that sometimes might get a little bit farther. And it also makes me think of the importance of doing research with partners. Like, we can think about policy change at like a real national or global level. We can also think about practice change at local organizations, maybe respond to survivors, provide prevention resources for perpetrators. Yeah, and also just a shout out to Research to Policy is one example of a group that's promoted research on the process of how might research influence policy. And it also reminds me of some work of community psychologists who are able to articulate, as much as I would love to have like 50 research articles that get cited and I can bring them from a collective of a research field and say, this is why I believe you should make a policy change. Sometimes it's the storytelling and the real from the grassroots efforts over a long period of time that helps like counter narratives and change people's minds.
Then I will move on to the next question. This is from the audience. How common or frequent is that both the wife and husband are underage in the child marriage? If that's a common case, what could be the implication for it? If anyone could answer.
Okay. Where I come from is not a common case. However, the situations, usually this happens maybe in high school, when children are in high school and they connect and everything. So the implication is mostly on the girl child. She is expelled from school. If a girl gets pregnant while she's in school, she's expelled from school. However, the family forces the boy and the girl to get married. So you will notice that the boy and the girl are quite young and they got married, but the girl child is actually expelled from her education. So that's the system that happens where I come from. Thank you.
And just to add to that too, I think globally, when this issue is discussed, it's primarily around an adolescent girl and a much older man because of that power dynamic. That is the problematic feature that folks want to try to avoid.
Thank you. And the next question is, most of you also touched upon like having a collaborative work with interdisciplinary teams. And in emphasizing that, how do you think such collaboration would be helpful in alleviating these issues? That's the question.
Sorry, Priya, maybe I'm saying too much, but I'm a very field-oriented person. So
Yes.
I was opportune to be part of the people who integrated the Chibok girls, some of them who escaped from Boko Haram. And then thank you all for the global support on Bring Back Our Girls, because that was what brought some of them, and we started getting them reintegrated in the society. So one of the things that I've noticed that helps in, okay, I said one of the things that I find very helpful in terms of collaboration is that, as you can tell, I'm not a psychologist, but of course, those people actually need psychosocial support. So you have to look for people who are in interventions that are providing psychosocial support to be able to support them. Another component is why while after that experience, I went into a HIV intervention, I also found out that something that I also found out is that while you're providing HIV and AIDS services, you also want to think about the nutritional aspect of it. People who live on drugs every day definitely need food. So you need a partner who is into nutrition. And even for the child, for the children who were born with HIV, of course, you need people like UNICEF for them to support with that activity. And now that I'm into agribusiness, in a lot of things that we do as we interact with people in the community, even when we do nutrition sensitive agriculture, you go and then you find children who are suffering from severe malnutrition. So you have to look for an International Red Cross Committee or International Rescue or something like that, so that you will be able to refer those cases to them. But again, like I said, looking at the expertise of different implementing partners is very critical. And that collaborative effort, that synergy is very important because the donor community is slim. So that means the competition on resources is very high. So as little the resources that we get, we have to utilize it judiciously. And the only way to utilize it well is when we collaborate with each other. That makes it more effective.
Thank you, Amy.
I thought that was really well put, and also agree that in whatever way and form that you can integrate in gender sensitivity, gender mainstreaming into regenerative agriculture, into disaster management, as Dr. Rezwana talked about as well, the more you can do that, the better, because it offers an opportunity to bring in new and different ways of thinking that elevates the status of women and girls into some of these new practices that assist with promoting livelihoods.
May I add? Yeah, thank you. I would say that actually, while I'm conducting my researches, I have found that there are I found lack of data and informations that what happens after disasters. Actually, the focus is on physical injuries and psychological impact or mental health condition, and gender-based violence do not get proper attention. And most of the time that I don't have data that what happens in these fields. So in these, so the physical injuries, we can get the numbers, death, of course, and damages, different economic damages. But what about and actually I did not get direct data. Few sporadic researches are there, and the scale is very, I would say that there is no micro scale research on these, that how and what numbers gender-based violence increases after disaster, every disaster in Bangladesh. This is one thing. So I would like to say that collaborative research with different organizations, with universities and NGOs, INGOs, and even government, if we can take government, and also we do the research and we focus all these perspectives. I think that this is the only way we can help the disaster victims, because the most of the time we can see one layer of the disaster, but disaster actually layered, and we don't see the other layers. So, and my concern is that the victim are mostly women, so and the children. So that's why I think that collaborative research is must to improve the condition. Thank you.
I think the next question is nicely connecting with what Dr. Rezwana is saying about being able to assess, the GBV and women's, and how can psychologists support the prevention of gender-based violence at the onset of climate disasters, if from a academic or social scientist perspective.
Is it for me, the question?
It's open to everybody, but
Okay.
please feel free to add.
Okay, I will say that actually I have found that the mental stress, and I'm not a psychologist, but as a geographer, and I tried to study psychology because I have just want to get their feelings recorded, that how they feel. Actually, most of the time they feel stressed, they feel the trauma is there, and they feel that they're sad, deep sadness, helplessness. And what happens that when this is a there is a, that in usual time men beat their wife, if this is a trend, this is a normal thing in the family. When the mental stress is increases after every disaster. Can you hear me?
Yes, we can hear you.
Can you hear me?
Yes.
Can
Hello?
you hear me?
We can hear you.
Okay.
Yes.
So the things that
I think your signal is cutting off a bit. I'm not sure whether she's hearing. Maybe if someone could take over and then we can come back once you sort that out.
Sorry, I got disconnected. Should I continue, or anyone is?
Oh, yes, you can continue.
Okay.
Yes.
Okay, so the thing is that we have to get the impact of, if we can assess and help them improve psychology, mental health problems, because the chaos in the family, and after cyclone, actually when everything is damaged, people feel panicked, they feel helpless, and relief actually most of the cases in especially the remote areas, they don't get relief until it is 24, 48 hours. So what they try to survive there, and that time actually what happens then, everybody feels trauma. So psychological mental health conditions should be assessed, and they should get the solutions or any help after the disaster, because actually there is no such data. Nothing is there on psychological impacts of disaster, especially in the remote areas of Bangladesh. So this is why we need help. Thank you.
Thank you for that.
Another thing could just be giving like emergency or essential service designation to existing GBV resources in an area. Rather than considering that, not an essential service that maybe doesn't need the emergency funding right now, really prioritizing, if there's an existing resource that is already working on this in an area, that is a group that may really need additional funding, additional support. I also so appreciated Amy's points earlier, and others spoke about this too, but the need to have women involved or GBV experts involved with planning for, where are people going to go after the disaster? What is the plan for if migration is necessary? Just at the bare minimum, very least, let's get some folks who know a lot about GBV, and hopefully especially GBV in that area, in this cultural context, to be part of that planning.
Great. So we do have an interesting question in the chat box. So I'm just going to read it over for you. One conversation I've been seeing about climate change is that there is an overpopulation of humans on Earth. I cannot help but think about the inequities that are at play with a statement, as well as how that rhetoric can intersect with gender-based violence, racial violence, and reproductive injustice. From your research, how have these things connect? And what are folks on the ground doing to push back on the overpopulation of humans on Earth narrative? Do we have an answer for that question? Anything related? Well, in that case, somebody would be able to follow up with that question, if anything.
I was going to say it's such an interesting question, and I'd love to hear more from Stephanie about her thoughts behind it and hear more about it, but I'd be happy to talk more about it offline. I'm not sure I have a great answer right now.
Okay, that's fine. We also have another question about the child marriage. Are there any research on the effect of child marriage on the development of PTSD and other trauma-related mental illness?
So I would like to speak briefly on both. The first one talking about overpopulation of humans on Earth and how it relates to this climate change. In my work, one of the things that I have seen is that disaster actually leads to increase in population. When you go to IDP camps or IDP, internally displaced population camp, people camp, or IDP returnees camp, what you see is production of children, and it's massive. It's accelerating at a very high rate. And why this happens, like from questions that we've asked and everything, you'll always find out that the response that you hear is, what do you expect us to do in the camp? Apart from producing children, the careless comments like that. Another thing I've also will say is that there is a lot of pushback, especially in developing nations, on child spacing or anything that relates to family planning or reduction in producing of children. I recall at the early onset of COVID, when we were talking about vaccines, in our Congress or in our House of Assemblies here in Nigeria, some of the which for us as a country is a problem. Anything that will lead to under reproduction is a problem. So a lot of people refuse to take COVID vaccine because they think after the vaccination, it will lead to impotency. So that's another thing. With reduced access to land and then with heightened appetite for control, people also think that the more children you have, the more access to land resources you gain, because with more children, it means you will have more people on your farms. You will also have more inheritance when somebody passes away. So there are a lot of things that happens. However, a lot of policy reforms need to happen. Deliberate advocacy needs to happen for us to come to understand this. But in dealing with these issues too, I think investment in education will go a long way, because the first thing is, what we've seen, that the more a girl child passes through high school, in my country, if she has passes through high school, the less the number of children she produces. But a girl child who just ends up with primary education might have 9 children, but a girl child who graduates from high school might decide that she's stopping at 4 or 5 kids. So I think a lot of investment needs to go into education for us to be able to take care of this. When it comes to research in terms of some of the effects of early child marriage, I think there are, like other speakers have said, and most of the people who are into research have said, people don't talk about these things. So it is even difficult for research and development institutions to actually go into research. There is a lot of cases of vescovaginal fistula in my country, but in some cases you will see that the mother is even hiding her daughter indoors. People even talk about it like it's a demonic attack. It's not even a disease that needs to go to the hospital. A lot of cases of cervical cancer because of early child marriage, but people are hiding it in their houses. They don't want to even bring it to the hospitals. So you can imagine if you present a questionnaire to this conservative population, will they even want to talk about it? So I think there is a little communication, there is little level of acceptance of researchers, and there are limited data in the hospital for people to even gain information about the aftermath of early child marriage. Thank you.
And I can add on to that to say that just to say that was really well put in the issue of child marriage. Amy is correct that there is not a ton of information about what happens after, because there's a lot of lack of access to those individuals once they are married and in those homes. But there have been some studies in general on coercive sex or exploitative sex that demonstrate that PTSD is a function of that. I'm thinking of one study that we did at the organization that I work for now that was looking at coercive sex in northern Uganda, and there were PTSD was demonstrated to be at a higher prevalence rate than those who had not suffered from it. So the implications would suggest that PTSD is there, as well as depression and anxiety. And I think one's also relationship to sex, their own body and their own sense of trauma in that regard is something that needs more research and more illumination when we talk about child and early marriage.
Thank you for that. And we also have another question directed to you, Laura, especially as a psychologist who engages in human rights work. What does the human rights approach bring to the table when we consider the correlates of climate change and GBV, the gender-based violence?
Sure, so I can give a crack at this, but happy to talk further about it with whomever thought of this question. But I was thinking, when you have the human rights framework, you think about an individual's access and a right to an education, a right to safety, security, and to decent work, and how those rights, when we think about the effects of climate change, are at risk. When we think about girls in child marriage instead of in education, or adolescent girls and young women in exploitative jobs instead of decent work. Thinking about women who are at risk of violence following a disaster event. So thinking about these as rights and kind of the injustice that is happening to the individuals that are being victimized in these situations. So using that from the clinical perspective, so using kind of a rights-based approach as well as a clinical approach to understand trauma, to understand where depression and anxiety comes from in those situations, and to also understand a loss of agency and power, because for adolescent girls and young women, this is fundamentally about them having less power and less agency to make decisions over their lives. And so how do we create structures, both in a clinical setting, but in the macro environment as well, to give them more power, more choice over what they want to do, who they want to marry, how long they want to go to school, where they want to work, making sure that we're fostering that in all the work that we do is kind of our highest priority.
Just following up on that, what we were talking about, like, I'm just thinking there needs to be more education and awareness with regarding to these issues. And in that sense, how can we integrate gender perspective curriculum into our educational context? And how do you think it's important for resolving this matter at an early age? Does anyone have any points for it? Just to kind of briefly.
I could say just a quick vote for early intervention being so important. I mean, like some, emerging work that have been part of in the US regarding like when violence and harassment becomes targeted towards trans youth, as one example of the gender-based violence is, this starts so young. Like if we wait to intervene with folks until they're older, we've just waited a little too long. And so some early intervention work for gender-based violence, this could even be quite broad social emotional learning, not necessarily talking to, people who are like toddlers about gender-based violence, of course, but rather about, who are safe adults in your life? What does it mean to be a good friend? And just starting this very young is a huge conversation in the US and a lot of developmental research right now.
Does anyone have any else to add on to that?
If I may I add that actually education is very important, and I think that it should be in different levels. Like we can go from different ages, because if we want to improve the condition, actually who are actually participating in violences, mostly adults. And so if we start from the children, we will hope for the better future. But if we want, I think that if we want to have a change a little bit, because we know that it's not going to change overnight, as we have to, but we have to start. And I think that awareness is very important, and educating them that what is the impact. Actually, if we can show them the impacts, what happens after child marriage, actually what women are losing, and the girl is losing because she cannot complete her education. She becomes dependent on the family, maybe parents, maybe husbands, whoever. And then she doesn't have that proper information for disasters. And climate is changing the rainfall trend in this country, and how to have a more you know that we are thinking about saline tolerant rice production, because we have salinity intrusion in our coastal regions. So like these all trainings, we need a basic education. So if we can show them that it is your, actually if you stop child marriage, let your daughter have more education, it is helping you. So in this way, the adults and then every age, and sometimes the in-laws actually, not only man is involved all the time, many cases mother-in-laws are involved, sister-in-laws are involved in dowry violence, directly involved. So we can also educate them, let them know that how and why you should not participate, and you should stop, because actually this is the power politics, we know, and we have to educate. There is an awareness there. So education is must, and it would be very helpful. We can think like this, that we can add everyone in different platform and then talk, because we can also invite families with their children. We can invite only like adults and children, like that. So, and of course in the educational institutions like school, college, universities. So this is how we can use education as one of our way that to improve the gender-based violence condition. Thank you.
Agreed. And I think that education is such a fantastic opportunity to bring in, as Dr. Rezwana said, different facts for children and adolescents to learn. Things like men who participate in caregiving roles, the various benefits that happen to that for children who are in those families, different things like that that may be different from what they've seen in their day-to-day lives. So that kind of data is incredibly important. And also things in the school setting where you see folks, I'll give an example from the US where someone might say, oh, so-and-so plays like a girl, right, with sports, and to actually step in and have teachers and peers step in and say, what does that mean about how you value girls? So taking some of those phrases that kids use, or phrases like, oh, if he's mean to you, it means he likes you. Phrases like that, where you can go in and say, no, this is not helpful, and this is what this can lead to in the future in terms of abusive relationships. So really starting young in an educational setting can give children and adolescents and even their parents more information and address some of these biases that devalue women and girls from the start.
Great. So we have only a few minutes left. Maybe like a summary or just a quick takeaway. Maybe I'm opening to all the panelists. If you could just like one key takeaway from your presentation for the audience that they are leaving this session, what would that be? And if you could quickly, in a very brief format, if you could tell, maybe that's something that they will remember once leaving this presentation, what would that be?
May I start? I want to say that actually gender-based violence are highly related to climate change. So when we think about climate change and disasters, we should think about gender-based violence too.
My summary, I suppose, is about the connection between climate change, the effects of climate change and economic stress, and for everyone to remember those connections with early marriage, risky migration, and GBV. So keeping their eye on economic stress and how that influences GBV.
Similarly, just this understanding and that GBV is so connected to context in people's lives. So continuing to respond to like acute crisis needs for survivors, as well as identifying and then pushing back on these like structural systems pieces that really complicate and fuel gender-based violence.
So finally, what I would like to say is, like we've already agreed in this room, and I'm sure our audience have agreed with us, that women needs to be in the decision-making room. Women needs to be where policies are created. They need to be where policies are being implemented. They need to be part of the leadership of this world because they've over the years nurtured a lot of leaders. It's only the person who wears the shoes that understand the pains that he or she feels. You know, we are not undermining the fact that men also experience violence. However, we also understand that research has shown 80% of the times it's women that experience it. And I want to add, again, investment in regenerative agriculture is the way to go for a sustainable climate, for a sustainable world. Thank you.
Thank you so much, all. Finally, I would like to take this opportunity to thank everyone for being with us today and making this a valuable and informative session. And thank you once again to all the panelists for their insights and valuable research work and in terms of developing it. And a special shout out to our intern, Laura, who brought this panel together. We really appreciate your hard work you put in to make this happen, Laura. Also, Sarah Mancall, who helped us throughout the event with the technical support at the back end. So again, if you, audience, if you have any more questions, please feel free to contact the SPICY team. We would love to maybe contact the panelists for you or follow up with any questions. So I hope this conversation doesn't stop here, but continue to evolve to create positive impact on vulnerable communities around the world. So thank you once again for joining us. Hope you have a good rest of the day and be safe.